This is Christina Fiore of MedPage Today. A new study suggests that patients won't benefit from aggressive treatment of low-grade prostate cancer. But a researcher we contacted for context on the study, Dr. Michael Naslund, director of the Prostate Center at the University of Maryland, takes a different view.
The issue that I have with this is the study makes the assumption that the biopsy decision is based on the PSA only, and that's just not correct. Physicians, primarily urologists, are the ones that make these decisions, and as a doctor, we don't treat a lab value, we treat a patient. So there's a lot of factors other than the PSA that go into the biopsy decision. So the presumption of the paper, which basically says if the PSA threshold is lowered, more people will be biopsied, is not necessarily correct.
Naslund doesn't see overtreatment as a huge issue.
Anytime a physician screens a patient for cancer, there's going to be overtreatment, because there's always going to be somebody who would have died, say, the next day, who doesn't need to be treated. So overtreatment is going to occur when you do prostate cancer screening or any kind of cancer screening. The question is the risk of overtreatment outweighed by the benefit that accrues to patients who get their cancer cured, which otherwise would have killed them? So that's really the issue that we're talking about. And there certainly are men who are overtreated because the PSA was tested. But in my mind, as a urologist, if a urologist, and I think most urologists do, by the way, use things like patients' age and health and their prostate size and the rate of change in the PSA, the risk of overtreatment is much, much less than at first glance you would think.
He says PSA is just one tool for risk assessment.
Medicine's not perfect, and those who think the PSA should be a perfect screening test are always going to be disappointed, because the PSA is just one parameter that a physician can use in trying to assess a man's risk of having significant prostate cancer.
The debate is likely to continue in this low-grade group. For MedPage Today, I'm Christina Fiore.